Hi everyone, my name is Kristen and I am going to be discussing Chapter 14, Medical Care Systems Worldwide. On my next slide, I discuss the report released by the World Health Organization ranking the 191 countries in the world. This ranking was based on level of health, health inequality, health system responsiveness and its distributions across groups, and financial fairness. France ranked number 1, while the United States ranked number 37. My next slide goes over the different countries I will be discussing: Canada, France, Germany, Japan, Switzerland, and the United Kingdom. My next slide discusses the different rankings of the countries according to gross domestic product. The United States is at the top with the largest economy measured by GDP, but we also spend the most. Japan is next with the second largest economy measured by GDP, but they spend around 39% of what we do. Switzerland is second, followed by Canada, and then Germany. My next slide shows the different populations in comparison to the United States regarding the countries I'm going to discuss. Their populations range from 7.9 million in Switzerland to 311.6 million in the United States. My next slide describes the different healthcare models we will be seeing in this chapter. The Beveridge model is characterized by government ownership of the medical infrastructure, and clinical personnel are public employees. Funds are generated through taxation, medical care is free at the point of service, and supplemental private insurance is available. The second is the Bismarck approach. This was first developed in Germany and is a universal insurance coverage through not-for-profit insurance companies selling mandated benefit packages. These packages are financed through payroll taxes or fixed premiums and must include all citizens. My next slide discusses the 9 key characteristics relating to healthcare delivery. You can find this chart in our textbook on page 393. The next 4 slides discuss Canada and their healthcare system and its disadvantages. Canada's healthcare system has a few challenging features because a majority of the population live within 100 miles of the U.S. border. Their healthcare system uses a mixture of the Beveridge model and Bismarck approach and allow for supplementary private insurance to help with costs for the things that the plans don't cover. I wanted to specifically point out the disadvantages because I thought they were very interesting. So I work at a doctor's office, and if someone needs high-tech services such as an ultrasound or MRI, it's usually within minutes or a few hours that they get these services. The wait time in Canada for an ultrasound is almost 4 weeks, and for an MRI is almost 9 weeks. So the next slide, titled Changes Headed Towards Canada, discusses a Canadian Supreme Court ruling that might have some beneficial healthcare system changes coming to help with those wait times. The next group of 5 slides discusses France's healthcare system and disadvantages. French economic and social policy is based on 3 principles: national spirit of egalitarianism, I probably mispronounced that, respect for individual freedom, and commitment to minimal state intervention. Patients are free to choose their own physicians, and a referral is not needed to see a specialist. Their system is primarily financed from social insurance, but also has a significant private complementary insurance component. This system has co-payments for services, and it must be paid at time of service, and then they apply for reimbursement, usually getting back around 75 to 80%. 90% of the covered population in France purchase complementary insurance to avoid balance billing and upfront medical costs. Physicians are suffering in France as they are getting paid less and less, and there are less and less of them. As of 2011, there are approximately 200 physicians in active practice. That's just 309 physicians per 100,000 citizens. They also have significantly lower salaries than physicians in the United States. The disadvantages of the French healthcare system are similar to Canada's, as they do not spend money on high-tech resources, so wait times for services are very high, and that's if you can afford them. The next group of 5 slides will discuss Germany. Germany has sickness funds that provide benefits to their 16 provinces. The German system of social benefits is based on the concept of social insurance as embodied in 3 founding principles: social solidarity, subsidiarity, and corporatism. Subsidiarity and corporatism. In Germany, you're required to have health insurance. Co-payments are low, and more is covered, but physicians are given a budget, and they will close their practice when that budget has been reached and won't open again until the next billing period. Hospital physicians are paid salary, and cannot treat patients on an outpatient basis. So when the budgets have been reached, it's a long wait time to find a physician. Physicians are paid much lower than physicians in the US, and just like Canada and France, they do not spend the money on high-tech services. The disadvantages of Germany's healthcare system is that the system uses the available resources inefficiently. German physicians provide more prescription drugs, have higher hospital admission rates, and patients stay longer in the hospital than any other citizens in the developed world, 45% higher than in the US. The next group of 5 slides discusses Japan. Japan has top life expectancies and some of the lowest infant mortality rates. They enjoy a life of low crime, low pollution, less social problems like divorce, obesity, and drug usage. Japan used Germany's healthcare system as a model for their own. Japan's health system is organized into independently administered health insurance societies that serve the members that are assigned to them. Employee health insurance covers 51.5% of the population, which is divided between society-managed health insurance and government-managed health insurance. Mutual aid societies provide insurance to national and local government workers and cover 8.6% of the population, and the other 3.9%, farmers, self-employed citizens, retirees, and unemployed, are covered by national health insurance. The next slide discusses the differences between the government-managed health insurance and the national health insurance. What I found most interesting about Japan is that their physician salary is on average $55,000 a year, and it's not unusual for these physicians to see 30 to 35 patients an hour. That's what my doctor sees in a day. So when they actually go and are able to see the physician, because it's first come, first served basis, they're maybe with the physician 10 minutes, but a majority of them are less than 3 minutes with a physician. Waiting times are bad, and citizens will give monetary gifts to prominent specialists in hospitals from like $1,000 to $3,000 so they can be seen quicker. The next group of 4 slides discusses Switzerland. The Swiss health insurance model relies on personal responsibility. Insurance is sold on an individual basis. Group and family plans do not exist. Resource supply is among the highest in Europe. Residents must purchase a health insurance plan or they will be assigned to one. Private insurance plans that cover deductibles and co-insurance costs are not permitted. They can have one to cover like prescription drugs and dental and stuff like that, but not deductibles and co-insurances. The Swiss have 2 types of managed care plans. The first plan is similar to the staff model HMO, and the second plan is based on general practitioner networks. Insurance is automatically issued at birth and is renewable, covering all pre-existing conditions, and the Swiss system is a reasonable alternative to the government-run insurance plans available to most of Europe. Lastly, the next group of 4 slides is discussing the United Kingdom. In 1911, British Parliament passed the first National Health Insurance Act, and in 1948, the National Health Service Act was implemented. Every citizen is registered with a general practitioner, and they act as gatekeepers to specialists and hospitals. Private supplemental plans are available to purchase, and in 2010, the Tory-led coalition government announced a plan to reform the national health system for the 6th time. They did this because the disadvantages are the horrible waiting list people have to sit on. My last 2 slides are a summary of the chapter, including the 3 guiding principles for private health insurance system operations and the different principles for social insurance systems. As the U.S. begins the reforming process of our healthcare system, it is important to remember that no other country has actually solved the healthcare spending problem, but we can use others' success and failures as a guide. I could not talk about all the different facts Chapter 14 described in the video, or I'd be talking with you guys for like 30 minutes. I tried to fit as much of it as I could in my presentation and encourage you guys to go back and read over all the different facts. It's very interesting to see how different other countries' healthcare systems are so different from our own, but then they have those little same qualities in there. So my question for the discussion post is, whose healthcare system do you think has the most potential to be successful in the United States and why? Thanks for watching.